Democrat out there, one progressive who's got a spine. You just heard him. Here's another one. Stephanie Miller, syndicated radio talk show host. Also, Jack Rice, former CIA agent, is with us tonight. And Heidi Harris is a talk show host on AM 720 KDWN in Las Vegas. Stephanie, good to have you on the program tonight. What are you hearing from your listeners? Do they believe that the Democrats are going to get this, or should I say the majority party? Are they going to get this thing done for the people?
You know, Ed, I got to tell you, I agree with you. Whatever health care plan we decide on, I hope it includes a spinal transplant for Democrats. I know you were in my hometown of Buffalo ripping it up this weekend, and that's the exact same thing I hear on my radio show. The same thing you're hearing. The American people are more liberal than the Democrats in Congress. I heard Howard Dean say today, Ed, we don't need Republican votes. And this co-op plan, this watered-down thing, is not going to work. We need a public plan.
Heidi, is there any room for negotiation at all for the conservatives when it comes to a public option, or is that, let's put it this way, off the table?
Well, they don't care. They don't need us. See, that's the whole point. So what I think should happen is the Democrats should go ahead and pass this, and then they will own it. And the Republicans can actually make a difference in 2010 and regain the majority, which they will when people realize it's basically government-sponsored, socialized medicine. And they will not be happy with it, but the Democrats have to take all the blame for this. That'd be perfect.
Is it socialized medicine, Jack Rice, or do you think the American people are willing to give this a chance?
Oh, the American people need to give this a chance. Come on, 1 in 6 Americans right now don't have insurance. There's millions more who don't have enough insurance. It's the #1 reason that people actually file for bankruptcy. The need is so desperate right now. The system is so flawed, so broken that they need something. And it's very clear to everybody who's ever faced the real problem. Everybody.
Question comes up, how are we going to pay for it? That question was posed on Meet the Press yesterday by David Gregory to the Vice President of the United States. Here it is.
Will the president sign a bill that taxes health care benefits for employees?
We made it clear we do not think that is the way to go. We think that is the wrong way to finance this legislation.
So if the bill comes with that, the president wouldn't sign it?
I didn't say that. We'll have to see what the whole bill says, but we made it clear. We do not believe you should be taxing the benefits that people receive through their employers now.
Heidi Harris, what's your response to that? You trust the administration on that?
Of course I don't. Of course they're going to raise taxes. They're going to have to. You know, the reality is it's not going to save anybody money long term to do this kind of program. You talk about inefficiencies. Of course there are inefficiencies. But government taking over, are you kidding? Government doesn't do anything well. They won't do this well, and it's a scary prospect. Besides that, the main reason they're doing this is to ace out the insurance companies. Government's going to come in. They're going to put a program together that will be easily affordable for everybody. Get everybody on that and eliminate the insurance companies. That's socialized medicine. That is scary.
Stephanie, what do you think?
And see, this is the problem with bipartisanship with our friends like Heidi and Rush Limbaugh, is she just said she wants health care to fail and then Democrats own it. Don't we all as Americans want to fix this health care system?
I would think so. Jack Rice, where is the political opening for the Republicans here? If the American people want a public option, and the latest numbers out there are 64%, if they want it, why don't they just get on board with it?
Yeah, you know why? Because they're trying to find the political lever that they have, and they don't have much. I mean, here's the funny thing the Republicans have actually been arguing. They've been saying that if you get this new system, it will be such a disaster that America will fail. That's on one side. Then the other side is it's going to be so good that the private industry will fail. So which one is it? It's going to be so good or it's going to be so bad? It's going to be one or the other. I'm really confused.
Heidi, what is your solution?
No, I didn't say it was good. I said that the government is going to offer a program that's going to be very inexpensive initially, and basically people are going to choose to give up their private insurers. They'll get on the government plan, and then the taxes will go through the roof, and we'll all be waiting in line. You've got to have private insurance to cover this. You can't put everybody on the government dole because you're going to wind up with rationing in the healthcare system.
The president did say that if you like what you have, you can keep it. Nobody's going to twist your arm on this.
I don't believe that, Ed, and because of the reasons I illustrated. They're going to make it so inexpensive that people are going to go, wow, I can save money if I go on the government's plan, and they're going to purposely give up their Blue Cross, Blue Shield, or whoever they have, and go on the government plan, and those companies will go bankrupt, so those won't even be around.
Stephanie, is this a Trojan horse to socialized medicine? Is it a Trojan horse to single payer?
It is not. I don't see how much more clearly the president can explain it. And Heidi, public option. The second part of that phrase is option. The president keeps saying, if you like what you have, you can keep it. What's so hard about that?
All right, panel, we'll come back. Stay with us. With all of the things that are going on in Iran right now, Jack Rice, obviously there's rioting going on. There's all kinds of dysfunctional things taking place. Could this, Jack, set the table for a possible revolution, or am I maybe overstating that possibility? What do you think?
It's a tough call because President Obama was just meeting with Prime Minister Berlusconi a couple of blocks from me at MSNBC studios right now where I am. The real issue is this, and what this really highlights is the need for the Americans to be able to reach out. Because if we had been able to reach out more closely with the Iranians in previous years, we may have driven them to have a more transparent election cycle. Now what we're seeing is even more instability, and that can ripple through the entire Middle East. It's a huge problem because of their impact in places like Lebanon and places like Palestine, and we really, really have to watch this. I'll tell you what, the Israelis right now are very, very nervous.
Heidi Harris, what should the president do at this point?
You know, I don't know if it's going to matter who ultimately is in charge, because the mullahs are the ones who really run Iran. So it's interesting to see the riots in the streets, and a lot of people have known for a very long time. A lot of the people in Iran are young. They're not happy about Ahmadinejad. They want a different type of country. So, but as far as who ultimately runs it, I don't. The mullahs are going to be in charge unless something really drastic happens with them.
Stephanie, your take on this. Should the president be very aggressive? He has just said that he's obviously disturbed. Should the president inject himself into this, maybe even to the point to say that there should be another election? What do you think?
Yeah, because I was looking at
I don't think that's a bad idea, Ed. I knew there was going to be trouble when I saw Catherine Harris and Ken Blackwell were in charge of the election in Iran. I think that, it just didn't add up.
Oh. Let's get Jimmy Carter down there. Why doesn't Jimmy Carter go
over 70%? Over 70% of the Iranian population is young, Ed, and they were largely for his opponent. And so, and there was a huge turnout. This clearly didn't add up. I don't think it's a bad idea to look into it.
All right. I want to talk more about Dick Cheney, if I can, for just a moment, and the conversation that he has created in this country about safety. His response to Leon Panetta's comment was, I hope my old friend Leon was misquoted. The important thing is whether the Obama administration will continue the policies that have kept us safe for the last 8 years. And then, of course, Leon Panetta backtracked through a spokesman this afternoon. He says the director does not believe the former vice president wants an attack. He says he did not say that. He was simply expressing his profound disagreement with the assertion that President Obama's safety policies have made the country less safe, nor did he question anyone's motives. Heidi, why do you think that Mr. Panetta backed off on this through a spokesman?
Well, I think Dick Cheney went after him and said, I hope he was misquoted. And Dick Cheney's correct. Dick Cheney does not want this country attacked. Are you kidding? I mean,
no, I'm not. I think he does for political gain, but that's just my take.
I do not believe he wants that for a second, and I think Leon Panetta realized he overstepped his bounds when he tried to infer that. Big mistake.
What about it, Stephanie?
Ed, you're absolutely right. I mean, Dick Cheney ran this play in 2004. He said terrorists will kill you, essentially, if you vote for John Kerry. Now he's saying terrorists are going to kill you because you voted for Barack Obama. It is politics and fear-mongering at its absolute worst, Ed.
Jack, is he, the former vice president, creating a problem for the agency, continually coming out and making charges that were not as safe under Obama?
No question about it. Every time he does this, he makes things a little less stable than they were. Remember, I guess, for 8 years, the idea that if you could commit war crimes and you could destroy the Constitution, I guess that makes us safer. So I guess, in a weird sort of way, he's right.
All right. Now, I want to go back to the health care issue about taxing. Heidi, I want to know, do you think that the Republicans will agree to anything when it comes to health care reform in this country with the president? What will they agree to, if anything?
Well, the Republicans have been told very clearly they're not necessary. And everybody talks about bipartisanship until they have the majority. The Republicans aren't necessary. Barack Obama is the one who said, I won the election. Basically, he doesn't care. I think the Republicans should back off, let the Democrats do whatever they want to do, and they'll take the blame. And the Republicans won't be listened to regardless. So why bother?
And Stephanie, why don't the Democrats just come out and say, hey, look, your taxes are going to go up. In fact, we're going to repeal the Bush tax cuts to get this done. I think this is part of the spineless end of it. I mean, they ought to just come up and tell people this is what we're going to do. Why don't they do that?
I hope Leon Panetta gets included in the spinal transplant for the Democrats, Ed. I'm with you on this. But Heidi, you know, this is the problem. The president has reached out extraordinarily to the other side, and he's gotten nothing. He's gotten 0 votes. So you can't say he's not trying. The Republicans are the ones that are not reciprocating. So I agree with Ed. The American people largely, if you look at the polls, want his health care plan. The Democrats need to get it done.
Yeah,
the American people want everything.
You're right. No, but you're right, Stephanie. The thing is Heidi, the president should take Heidi's advice. Don't even talk to the Republicans anymore. Just do what you're going to do. We hired you for a reason. We hired the Congress, the House, and the Senate. Drive forward, do what needs to be done, and we'll go on and deal with the consequences. Imagine, he's actually serving America. Shocking.
I think the president needs to come out and just say, look, we're going to do some health care reform in this country. This is what I was elected to do. We're going to have to raise some taxes. We're going to repeal the Bush tax cuts to pay for this. And I bet that he would just walk to re-election in 12, and I don't think that they would be dinged at all in the midterms. We'll see. Panel, great to have you with us tonight. Thanks so much. That's the Ed Show. Chris